This is Seamus Stark for the Ringwood News Network, coming to you from Tavistock Square in Bloomsbury in London, where today, 4th of March 2017, there is a rally taking place against the cuts to the National Health Service.
We're really excited to be here today because we care about the NHS. I'm a doctor myself, and I worry very much that the NHS isn't in the same place as it was 5 years ago and is breaking apart. We're also a part of the Green Party in Winchester, and just a small number of people out of the big group in Winchester, and we really support the NHS, and that's why we're here.
That's great. And you were here with your whole family, yes?
Yeah, my whole family, yeah.
I'm here today not just as chair of the Junior Doctors Committee, but here speaking for the BMA, and also as someone that works in our health service. I'm here to join my colleagues from across the profession, nurses, physiotherapists, all of our allied healthcare colleagues, and also our patients, our members of the public, as we start to really talk about the damage that's being done to our health service and call for real changes to help our health service survive.
And what do you think of the current plans for the NHS? And if it's going badly, can you tell us why, in your opinion, it's going so badly?
Well, I think plans actually in and of itself is a very generous term, because actually what we're seeing with these STPs, these sustainable transformation plans, is actually a series of 40 to 44 bleak assessments of our health service. And actually what they conceal is £26 billion in cuts that our health service simply cannot endure. Actually, rather than putting money into a health service where we are trying to drive more care into the community, we are taking money exactly the other way.
I'll say what's happening now is it's being privatised, but in a really underhand way. So lots of contracts are being given away to private companies. And I think they'll always put their profits above what the people actually need. So I think as someone who needs the NHS, who uses the NHS, I'm really concerned about it one day cut into a situation where it's not free at the point of use anymore. We have to start paying, and it's based on money and not need.
I definitely feel that coming here today to try and get our voices heard and try and express how we feel about our desire to keep the NHS.
The British Red Cross has described the situation for British healthcare as a humanitarian crisis. Could you say a little bit more about this?
Well, the humanitarian crisis has developed over Christmas because the government underfunding not just of the NHS was also underfunding social care, and the privatisation of social care has made it almost impossible for patients to be discharged, elderly patients to be discharged home into the community, because there isn't the money to fund care workers and there aren't the care homes for elderly people to move into. And so there's actually been a crisis in the hospital service. Noam Chomsky foretold this. He said that when a government wants to privatise public services, the first thing they do is to defund them. Then the services don't work well, people start complaining, they want to change, and then the government comes up with the idea to privatise the health service. So that is exactly what's been happening to our health service.
The NHS, I depend on it. I am disabled, as you can see, and I need doctors, I need hospital appointments, I need treatment, I need medicine. Without the NHS, I wouldn't be able to afford any of that, and I wouldn't be able to survive. So I don't want the NHS to close, because I don't want us to go back to Victorian times when it was the privilege of the rich to have medical care and treatment in hospitals, and everyone else had to go to charities for any support if they were lucky, and if they weren't, they just died in misery and pain without the medication they needed.
So you joined the DPAC?
No, I'm with DPAC because of the cuts. The cuts not just to the NHS, but to social welfare, to services, they're cutting the guards on trains, for example, which will prevent disabled people being able to travel. As it is, we can't travel on trains and tubes and buses very easily. But when they take away the guards on the trains, it's going to be so much worse. So yeah, it's a whole barrage of cuts that are affecting disabled people particularly. and affecting everybody, but it's disabled people who are feeling it the worst because we're at the sharp end of it.
Well, the NHS reinstatement bill is a long-term project to win back the NHS into public ownership, publicly provided, publicly accountable through the NHS, to the Secretary of State for the Health Service, and accountable to the people that pay the taxes for the health service. Now, over the last 20 years, market forces have been brought into the health service as a completely wrong philosophy that competition will improve the efficiency of the health service. So we've got the breaking up of the National Health Service into smaller and smaller units, more and more contracts going to private companies. And the Secretary of State gave up his duty to provide the health service under the Health and Social Care Act in 2012. So since that was implemented in 2013, the health service has gone down and down, and when he wants to, the Secretary of State washes his hands of it and says it's not my decision. And when he wants to interfere, like for example the junior doctors' contracts, he interferes hand over fist. There have been now five iterations of the NHS bill, 2 in the House of Lords and 3 through the House of Commons. And it was led by Professor Alison Pollock and Peter Roderick, who wrote the bill, and Lord David Owen, and a group of us who have said that we have to roll back the serious damage done by the Health and Social Care Act and to bring in new legislation that wins back a publicly provided NHS.
My name is Ghazala Bhatt and I am from the Hounslow Heath Labour Party member, and I am the treasurer of the Hounslow Heath ward, and we came here to support our NHS.
Well, the cuts are really drastic for midwives. We need 3,500 more midwives, and you have to remember that midwives are at the birth of babies. They're the basis of the birth of our future. We need 3,500 more midwives, but maternity services are being cut. We believe that in some situations the reconfiguration of maternity services is good, but not when it's just an excuse for cost cutting. So we want to see the government improve resources to the National Health Service. We also want to see reinstatement of bursaries for student midwives who are our future.
I'm with Kathy and Mark. They're from Australia, but they're living in London at the moment. Kathy, why have you come here today?
Well, I've come here because the NHS needs to be saved and it needs to stay in public hands. Very, very crucial, because people can't afford medical treatment. People will die without the NHS.
Yeah, it feels like our society is being sort of hijacked by people that don't have the people's interest at heart. So public, disobedience, disorder is really important right now, and so we just wanted to make up the numbers.
Well, since 2010, when the Tory Lib Dem coalition came in, they brought in something called the Health and Social Care Act. And what that has done is introduce competition, compulsory competition into the NHS. And it's led to a great deal of fragmentation and part privatisation of the NHS. But what it's done is create a market in every level of the NHS that wasn't there before. So it's led to probably £10 billion a year wasted on this market. And how it's affected general practice is that there's been funding cuts to general practice, and some inner city practices used to receive a bit more funding relative to people out in the shires. That was to take account of the extra deprivation in the inner cities, because basically what makes people poor is poverty. It isn't smoking or, none of those things are good for you, but it's basically poverty that makes people poor. So the inner city areas did have a slightly more money. What they've done is they've said, we want to equalise that all around the country. So it means that the inner city areas with highly deprived populations have had big cuts to their funding, and it's also meant that there's general cuts as well. And it's led to 500 practices around the country closing, and several more at risk of closing. And each time a practice closes, there's somewhere between 5,000 and 12,000 people without a doctor, depending on the size and where they are. And it's really difficult because there's the other practices have fallen at capacity. They can't just suddenly absorb 10,000 extra patients. And so there's a real general practice crisis where appointments are hard to get, and the government's saying that we can save billions of pounds by keeping people out of hospital and putting them into the so-called community. But the problem is there's been billions of pounds we're talking huge amounts of money here.
Well, I think we've got the coming together at the moment of 3 or 4 different levels of crisis, of problems that have been created over quite a time. And the biggest underlying problem is that the NHS funding, which has been frozen since 2010, since the coalition government took over from Labour in 2010. This government has implemented an austerity policy on public services, which has meant a freeze in real terms on NHS funding, while costs have continued to go up, the population's grown, and so we've got a growing gap between what we need to spend on health and the amount of money that's actually available to deliver health services. And this resulted over this winter in a series of winter crises in which we ran out of beds. Beds were running 100% full in hospitals, people waiting on trolleys, ambulances waiting outside hospitals. On top of that, we've had now again successive years since 2010 of actual cuts in social care funding. That's the services outside of hospitals. That was also being cut year by year. So it's now been cut by 37% since 2010. By 2020, if it carries on like this, it will be down to 28% of what it was. In other words, about a quarter of what the spending was in local government compared to 2010.
BBC, defend the NHS!
To see more of our coverage, visit therealnews.com.